Melissa Fuller with Shape of the City. I am at the Food Bank of Lincoln. I'm with Scott Young, the Executive Director. Hi, Scott.
Hi, Melissa. How are you?
I'm good.
Good.
So tell us a little bit about, for the few people who may not know who you guys are, what is the Food Bank of Lincoln?
You know, the Food Bank is a 36-year-old nonprofit. Our mission is to alleviate hunger in southeast Nebraska. We serve 16 counties, and in those 16 counties, there's about 58,000 people who are struggling with food insecurity issues, and almost 19,000 of those people are kids under the age of 18. So we've got a lot of work. It takes a lot of shoulders to the hunger wheel, but the volunteers and staff and board and the community treats us really well.
What populations besides youth are you serving, and how are you getting the food out to those people?
You know, we serve veterans, we serve seniors on fixed income, we serve the homeless, we serve people in alcohol and drug rehabilitation centers. We have 52 agency partners and over 70 school partners that partner with us to distribute our food. We're basically the hub of a hunger wheel, and so we've got a lot of partners that are distributing food bank food.
Give me an idea of some of the partners that you might work with or where people might see you guys.
People City Mission, Center for People in Need is our biggest distribution partner. Good Neighbor Center, Matt Talbot Kitchen and Outreach. Most of the nonprofits in the community, with the exception of Meals on Wheels, which is a menu service, so we don't have that consistent of a supply, but we hope to partner with Meals on Wheels in the future on some things. But most agencies that are feeding people in our community are using the food bank to some extent.
And how are you guys funded?
We're funded by donations largely. We've got a couple of small federal contracts, but in general, we are funded by foundations, individual giving. Holiday giving is a peak time for not only the food bank, but for all of our partners. And we're just beating the bushes all the time for time, talent, and treasure.
That's wonderful. Speaking of the holiday food drive, the holidays are coming up. Tell us, how are you guys going to be getting out there?
Yeah, we try and provide people a lot of easy ways to give to the Food Bank of Lincoln. And right now we've got the checkout hunger activity going. This is where you can go to your favorite grocery store and pull off one of these coupons as you're checking out. The idea on this is most people pick the middle coupon, so we were going to have an $87 coupon here, but I couldn't get any support on that, Melissa. So people just do a $1, $5, or $10 coupon. It's swiped at the checkout counter, then they get a receipt for that giving, and that money is used to buy food in those stores that we are most in need of here at the food bank. We also have the holiday food drive going. We've got the barrels, the big blue barrels with posters on them that indicate that people can drop a bag into the food bank barrel, and we'll get it back here to the food bank and get it distributed really fast.
Now, I think it's obvious, but can you explain to our viewers, why is an organization like yours so essential, especially to this community?
Those of us that are thriving and able to thrive need to help those that aren't, because it's really for the betterment of all of us. So when we help those who really need help the most, we're helping all of us. And I think that's what makes this community strong. It's what makes communities strong across America. Those of us that got it good need to make sure we're looking out for those that don't have it quite so good.
For our viewers that want to make a difference, that may want to donate or even volunteer, where do they need to go to get that information?
We would invite them to go to lincolnfoodbank.org on the web, and we've got volunteer sign up, we've got donation areas on our website, and there's a lot of ways that people can help.
Perfect. Thank you so much, and good luck for the holiday season.
Melissa, thank you.
My name is Damon Hershey. I'm one of many people in Lincoln that rides a bike year-round. It is important for winter riding to be prepared, especially being visible. You want to have a good quality light. You want to be visible to all road users. You want to be sharing the road. You also want to remember the 3-foot passing law. That's a safety for both the cyclists as well as the motorists. And of course, if you'd like to find out more, you can visit lincoln.ne.gov.
20 people per minute are physically abused in the U.S. by an intimate partner. Domestic violence is a topic that's relevant to us all. To talk more about domestic violence as it relates to the Lincoln community, I'm joined by Marcy Metzger with Voices of Hope and Sheila Dorsey-Vinton with the Asian Community and Cultural Center. Hi, guys.
Hi, Melissa.
All right, let's start with you, Marcy. Let's talk about the community as it relates to domestic violence. What are the the big issues or big topics that people really need to know when it comes to domestic
Well,
violence?
first off, I think people need to know what happens in Lincoln, Nebraska daily. It happens to women, it happens to men, it happens in our community. It is the largest it's the largest violent crime that's reported to the police of anything in Lincoln. And I just heard that from the chief of police recently. So when we talk about making sure that nobody is alone because they think there's no resources, or they think that it doesn't happen here, or they think that it's not so bad with what's going on in their lives, they need to know that they're not alone. I think the other thing is that people need to know that they can make safe referrals. That's starting with believing the victim as being the expert of their own lives, so that when they're saying they're unsafe, that we take them seriously, because they are the ones who have experienced the tactics that abusers use to control them. So for us as community members, we need to know that it's happening here and that we can respond, both in terms of providing safety and support, but also referrals to places like Voices of Hope and the Asian Center and Friendship Home, the Police Department Victims. So there's other places that people can go when they're experiencing this.
So just to be clear on messages, if you're referring to domestic violence,
Right.
how would you define domestic violence for our viewers?
Well, intimate partner domestic violence for us would be a continuum of violence. So when you were quoting those first statistics, that was physical abuse. When we're talking about this in our community, though, we're talking about both physical abuse, economic abuse, psychological abuse, sexual abuse. All of those fall into what we're defining as domestic violence.
We talk about the overall population, but are the immigrant and refugee populations, are they more vulnerable in these situations?
Well, just to reiterate what Marcy has already said, domestic violence happens across all socioeconomic levels. It happens to people from all cultures. It is not an issue that is specific to refugees and immigrants. But yes, in fact, they are more vulnerable because there are some key factors that make them more vulnerable. So one of them might be that if they don't have documentation, intimate partner can use that against the person in coercing them to do things and have that fear over their head, and also just taking, even if they have documentation, taking their papers away. And in some cases, there are some cultures where and some people in specific cultures believe that it's a man's right to abuse a woman. And so those are some factors to deal with as well.
I would echo that, because I think that anytime we have individuals more isolated and more able to be able to not access resources, we've got increased vulnerability. So that can be the Asian community. It can be those that are from all the partners that the Asian community responds to. And we've had an ongoing project that really focuses on making sure that individuals who are isolated in their home because of language, transportation, fear that people will judge their culture, all of those things become great barriers for people coming forward to even finding out if there are resources. Somebody who's not documented, we would always serve. Somebody who is not documented also has ability to have access to the police department, access to self-petition for being able to get a protection order. All of those kinds of things they have, regardless of what their documentation is.
And even access to immigration services if a person has domestic violence in their family.
So November 25th is the International Day for the Elimination of Violence Against Women. What can we tell our viewers? What can they do to make a difference to help sort of maybe listen, or whether they're experiencing violence? I guess maybe some of our viewers don't even know what they can do.
Well, first off, I would say that broadening this beyond the domestic violence that we talked about earlier. In Lincoln, we are seeing human trafficking of both international and local. We are seeing sexual assaults, and we see a number of sexual assaults that are men as well as women. We are seeing a number of things that tie into gang-facilitated violence, specifically targeted towards women. In this community, we are not isolated from the rest of the world. And so when we talk about ways that people can help, first off, they have to be able to talk about it. So educating themselves about the fact that it does happen here, and that when they hear of it, they can speak up. They can speak up against the kind of statements that create the culture of it makes this okay. You can't, because Arabic, are always doing this. That's not true. It is just as likely, more likely in our community, that it is a Caucasian Christian family that we're responding to. So I think that getting rid of the myths are really important so people feel safe responding. Second, I think it's always really important that we pass the word that there are safe places for people to talk to about this. Right? And this is an international focus. So this day, even more, the El Centro de las Americas and the Asian Center and Voices of Hope in our partnership have a lot of ways that people can talk to individuals that are more specific to the culture that they may be coming from. So I would say that that's also very important.
Right. They can come and talk to our staff in their own language and know that the staff have been trained in working with Voices of Hope, especially in serving them if they are experiencing domestic violence. But also some of the viewers out there might have friends who are experiencing domestic violence and know that you can talk to these places to get advice for your friend as well.
Are there any other messages you want to leave with the public in terms of where should they go for help, where, for anyone who may be out there?
Well, in Lincoln, we're very fortunate because we have a coordinated response that includes several shelters, primarily Friendship Home and St. Gianna's Shelter that really worked specific to violence against women issues. All of our culture centers are involved in training and referrals that are most appropriate. The crisis line, there's an English crisis line and a Spanish crisis line available, but if somebody calls our office number, whether we hook them up with somebody at Agents at Community Culture Center and one of our liaisons, or whether we tie into our national network, which has us have the ability to speak 150 languages in a, what am I trying to say, a way that we can translate those together at the time of the violence and be able to do safety planning immediately. So people knowing that there are services available 24 hours a day are really important.
Well, I think a really important statistic that I just saw in the Lincoln Journal-Star is that 43 women and children are waiting every single day in Lincoln for shelter. And that number seems really startling to me, and that we should just be aware that domestic violence is happening all around us, and probably you may even know somebody who's experiencing domestic violence, and they just haven't told you.
Knowledge is power, and hopefully we can spread that knowledge to the rest of the community.
Thank you for having us today.
Thank you.
Yeah, thanks.
Globally, 1 in 3 women and girls worldwide have experienced physical or sexual violence during their lifetime. Less than 40% of them seek help of any sort, and of these, only 10% seek support from police. And of all women who were victims of homicide worldwide in 2012, 50% were killed by intimate partners or family members. This situation cannot be overlooked. And although progress has been made, the end of violence against women and girls is far from today's reality. UN Women is committed to this cause and works with governments, national actors, women's organizations, and the civil society to end violence against all women and girls. The international community recently agreed that ending violence against women and girls is an important target for a sustainable future and a crucial matter to achieve the SDGs. During this process, we must make sure that we reach the lost woman. By its presence in more than 85 countries on all world regions, UN Women actively contributes to making this possible. We support countries in many ways, including adopting, implementing, and evaluating comprehensive laws and policies, addressing the root causes of violence through prevention strategies, and working with communities to change the social norms. Ensuring that essential services and support are accessible to all survivors. And collecting data and conducting analysis to fully understand the nature and extent of the problem. UN Women envisions a world where all women and girls are equal and empowered members of society, free of all forms of discrimination and violence by 2030. But let's not wait until then. Let's act now. We need your help and commitment to make sure that we reach the last woman. Together we can make it happen. If not now, when? If not you, who?
Nearly 1 in 10 Americans have diabetes, and about 1/3 of the adult population have prediabetes. So what does that mean for us? Today we're going to learn a little bit about what that means and how we can make a difference. I'm here with Carrie Erickson from the Nebraska Urban Indian Medical Center, and I am with Dee Kaiser, Great Plains Quality Innovation Network. All right, well, thank you guys for coming out.
Thank you for having us. Glad to be
All
here.
right, so let's start out. Can you give me sort of what is diabetes and prediabetes? What do we need to know?
Diabetes can be confusing in a sense because there are many types of diabetes. There's type 1 diabetes where the body just doesn't make enough insulin. It can develop at any age, and it accounts for approximately 5% of the population. Type 2 diabetes, on the other hand, is where your body just doesn't use your insulin effectively, and it accounts for 95% of the population's diagnosis of diabetes. And prediabetes is defined as blood sugars being higher than normal, but not yet high enough to be considered or diagnosed as type 2 diabetes. But the good news is there's ways to prevent prediabetes and type 2 diabetes. So.
Right. We know there are a lot of risk factors for developing type 2 diabetes, and some of those are obesity or being overweight, and others are inactivity or a sedentary lifestyle. So if you know your risk factors for diabetes, you can help prevent the diagnosis by doing some interventions soon to help reduce those risk factors. Now, when we talk about risk factors, it's for type 2 diabetes and prediabetes. Type 1 diabetes is not with the risk factors of obesity and sedentary lifestyle and heredity. Type 1 diabetes is an autoimmune disease. We never know when it's going to strike, and there are no risk factors for it. But Carrie and I, both of our organizations, are trying to help with diabetes self-management education, offering group classes free. And with my organization, Great Plains Quality Innovation Network, we use a curriculum called DEEP, which stands for Diabetes Empowerment Education Program. And those classes are offered throughout Lincoln at different sites. They are free. They are 6 weeks in length, and classes meet once a week for about an hour and a half. And that curriculum is built on a lot of interactive activities and adult principles, so the classes are for those age 18 and up.
Dee, can you tell us a little bit about your organization, so for the people who may not know?
Sure. So Great Plains Quality Innovation Network is a quality improvement organization that's funded by the Centers for Medicare and Medicaid. We are part of a 4-state group. The Dakotas, Kansas, and ourselves make up the Great Plains Quality Innovation Network. So I represent, of course, Nebraska, and one of the initiatives that I'm working on is called Everyone with Diabetes Counts, and that initiative, the tasks that are involved in that are to offer diabetes self-management education to Medicare beneficiaries, low-income minority groups, any disparate type population that wouldn't otherwise be able to receive quality diabetes self-management education and support.
Perfect. All right, Carrie, can you tell us about your organization as well?
I work with Nebraska Urban Indian Medical Center, and we are a family practice clinic, and we serve all ages from birth to elderly and all race ethnicities. And we offer group education classes to the community, and we send out flyers and try to advertise those every month on different diabetes topics such as healthy eating, exercising, monitoring your blood sugars, taking your medication, the importance of taking care of yourself to prevent complications from diabetes. And we also offer one-on-one individual education for our established patients. And so they can see myself, the diabetes educator, as many as 1 to 10 times a week if need be, just as much as the patient needs, and it's individualized. So we're there to offer free education both in the group and individual settings. So.
And you mentioned again, these are free and open to all public, correct?
Right, yes. The group education classes are open to the public, and we invite all of our cultural centers around the community and try to spread the word to get more people, because we know how important education is to manage diabetes and to prevent it. So.
All right, so both of you are part of Action Now as well. Can you tell us a little about that collaboration?
Yes, Action Now is a committee that Dee and I are both on, as well as other community members and organizations in Lincoln, to work together to try to spread diabetes awareness to the community and spread the word of resources that we offer throughout Lincoln to help patients that are newly diagnosed with diabetes or that have lived with it for years.
We have a lot of members from the community. Anybody that actively involved with diabetes education, diabetes educators, they all are welcome at the table. So we hope to be more active in the community, be a more bigger resource for providers and for people who are living with diabetes, as far as where can they get education, what are reputable websites, and different things of that sort.
So for our viewers, what's the next step for them? Where should they be talking to people? Where should they get more information? What would you suggest?
I would suggest, first and foremost, we're trying to get the word out to local healthcare providers. So if they would start there and find out if there are resources within their facilities where they go. The local hospitals are part of our Action Now and can give resources, along with many websites that we'll list at the end of today to let people know what we are offering, so, and what's out there.
Right. And I know you'll list my organization's website, but we do have partners all across the state that are offering what we call the DEEP curriculum, which stands for Diabetes Empowerment Education Program. And those workshops are free, and in some communities they're offered in Spanish also.
There are probably a lot of people out there that are saying, oh, this doesn't affect me. I don't have diabetes. Why would I have diabetes? There are a lot of people that don't know they have diabetes, correct?
Yes, so it's important to, every time you go to your doctor or just make an appointment, to go to get screened for prediabetes or diabetes, because a lot of people do have it and don't know they have it because there are no symptoms until they get really sick. So we're trying to get the awareness out there so people can get their health taken care of before it's...
Right. The American Diabetes Association's website offers a risk test that people can take to see if they're at risk for type 2 diabetes. And I would encourage anybody that wonders, is this something that maybe I could be looking at as a diagnosis later in life or now or whenever, to take that risk test and see if they score high on it. Type 2 diabetes has a huge genetic link. So if you have parents, siblings, or even your own children that have type 2 diabetes, that in itself puts you at a higher risk. Anybody over the age of 45 puts you at a higher risk. So there's a lot of things that people don't think about as a risk factor for themselves. So I would definitely promote that risk test.
Well, thank you both for all the work you're doing, and we'll try to get the word out and make a difference.
Absolutely, thank you.
Yeah. Shape of the City is dedicated to keeping Lincoln informed of health and wellness programs and events. Visit our calendar at lincoln.ne.gov, keyword Wellness Calendar. If you'd like to see your program or event covered, email us at LNKTV Health at lincoln.ne.gov.